Hi, it's Richard and Louis here, the advanced nurse practitioners from the Ledger Clinic, and we're going to talk through, this is probably the one we get the most questions about, isn't it? We're going to talk about preparing your HCG injection. So in front of us on the table here, we've got some bacteriostatic water known as Torback. We've got 2000 IU vials of HCG. It does come in 5000 IU vials as well. We've got a reduced dead space 1 ml syringe. We've got a 25 gauge, a 27 gauge needle tip, and we've got a 29 gauge fixed 1 ml insulin syringe. So we've got these here for drawing up the medication, and we're just going to go through the process of how to do that. So the first question we get all the time is when people open up the HCG, you can see that there's a syringe in there with saline solution. We just completely disregard that. So the saline solution is there because HCG is normally taken in one dose if it's used in females. When we're using it in men, we're using smaller doses more often. We use the bacteriostatic water because it's got more alcohol preservative in it. It's going to prevent bacteria buildup over multiple uses. Louis will get one of the vials of Torback now. So I'll pop out the vial of HCG and we can just disregard everything else that comes with it.
Okay.
Yeah, got that. So we pop the cap off. You'll see that it's got a rubber stopper there, which means that we can use it for a couple of doses. And we've got the bacteriostatic water there. Louis will show you just how to make sure you've got all of the medication into the vial.
So just in case there's medication on the top of the vial, okay, there's two techniques you can use. One I like to use is tap and then slide it around. And as you can see, there's pretty much nothing left, just a small air bubble at the top. But the other technique you can use, you just flick it. Just made it a little bit worse. And gone.
There we go.
Okay. And then you break the vial, always from the spot turning facing you. You put your thumb, break the vial, and sharp spin.
The sharp spin. So I've just popped the 25 gauge needle tip onto the 1 ml syringe there. So we're going to use this to take the Torback out and inject it straight into the HCG vial. The amount of Torback water that you're going to mix is going to depend on the size of the HCG vial. If you've got a smaller 2000 IU vial like this, then we advise to put 0.8 of a ml of the Torback water in. If you've got a larger 5000 IU vial, you're going to add 2 ml in. And that helps to keep the doses consistent. We'll speak a little bit about that. So, with this being a 2000 IU vial of HCG, I'm going to take 0.8 ml out of the Torback. So if you pop it in, I just start drawing up that. You'll see it's very easy with it being water. Come up there. We'll give it a good flick. There's quite a few air bubbles in. We want to make sure that we're getting close to the right amount. Probably a little bit more. If we come up. There we go, we're at the 0.8. That then gets injected straight into the HCG vial. If you pull that out, you then want to give this a good mix. It's powder that's in the HCG, so you want to make sure that you mix it well. And yeah, I need to pop that into the sharp then. So there we go. We've got, you can see that the powder is all mixed there, and you've got the 0.8 mils inside of the HCG vial. Depending on your dose, it'll depend on how much your injection will be. If you're using 250 IUs, that's going to be 0.1 of a mil. If you're using 500 IUs, that's going to be 0.2 of a mil. But your doctor or nurse will talk you through what your dose is and how much you need to draw up. So once it's mixed, this needs to be stored in the fridge and it's good for 30 days. After that, the medication's going to start to degrade. In terms of preparing your injection, you can use 29 gauge all-in-one insulin syringe. If you open that up, take off the cap, and I like to just pull back a little bit of air, inject that in, and then you're going to draw out your dose. So in this case, you can see it comes out quite thick with it being water-based, and we'll just inject the excess back until we get to the exact dose that we want, which in this case is 0.1 mil. That would be 250 IUs. If you remove that, it's then good to go. You can give this a flick just to make sure that there aren't any air bubbles. If there are, you can just locate them centrally under the needle tip and push them out, and that's your medication ready to inject.
So, and you think at the end, oh, I've got so much Torback left, what can I do with it? Don't discard it. You can use syringes and then transfer it into an empty multi-dose vial, and you can save it to use for the next syringes. It's a simple technique to transfer. You just draw all the medication into a syringe. Thank you, Richard. And you can tip back, you pull all the way until the end. Quite easy to pull. Okay. You can take some of the air out, and then you just transfer, try and hit the middle. You just transfer, and you just bring all the air. Don't forget, about halfway, just pull some air out so to relieve some pressure inside the multi-dose vial. And you just bring the rest of the Torback in. And you just keep repeating that until this vial is empty. And once that, then you discard your syringe and needle into a sharps bin. And then once you got all of the Torback inside this, you can then discard this into the sharps bin. And then you have some saved Torback that you can use for multiple HCG injections. So at least save you some money on the Torback. But if you do have any questions, don't hesitate to ask us, okay?